Ready to shine inside out? Welcome to Polished Beauty Podcast, where ambition meets empowerment. We talk business, beauty, brain, body. I am your host, Dr. Daisy Ayim, triple board certified cosmetic surgeon and OBGYN. Let's get polished. Hey everyone, welcome to another episode of Polished Beauty Podcast. I'm really excited about this topic and I've been waiting to discuss it with you guys today. So, this is an episode that I'm diving into a topic that is incredibly important, often overlooked, and that's feminine moisturizers. Yes, I'm going to talk about vaginal and vulva moisturizers. I want you to say that word with me. Vulva. We all know what vagina is. So this moisturizers that I'm going to talk about with you guys today, it's basically products that are designed to give us hydration in our intimate area, and it helps with our health, And this is something that I feel that it needs more attention. We need to talk about it more and we need to care for that area more. So let me demystify some of this topic. Let's talk about what's available. Let's talk about how does it work? Meaning vaginal moisturizers or feminine moisturizers or vulva moisturizers work? What is their risk? What is the benefits? All right. Throughout this podcast, you may hear me interchange the word vulva moisturizer, vaginal moisturizers, feminine moisturizers. They're all implying the same thing, okay, guys? So please don't get confused if I happen to use one terminology over another. They're all pushing the same narrative, okay? So feminine moisturizers are products, like I mentioned, designed to elevate vaginal dryness and help with discomfort in the vaginal vulva area. This dryness can happen due to many reasons, right? It's usually hormonal changes. That's the more common one. So we know menopause, perimenopause, that situation. But what about breastfeeding? Yes, breastfeeding can cause hormonal changes. And, you can see a young mom in her teens, in her 20s, and even 30s, she's having concerns about not being properly lubricated in her vaginal area. Yes, so that also could be a reason why feminine moisturizers are needed. Certain medications that you take as a woman, it can definitely affect your lubrication in the vaginal area, okay? And also your lifestyle. I always go back to lifestyle, and that's really boils down to your stress factor, your hygiene, and your nutrition. All of that can affect your feminine moisturizer needs, all right? So I want to break it down into three big categories. That way it's easy to understand. So the first one is your daily use moisturizers. These are like your products that is just important for hydration and it's very important for just balance. So you can use it every day for a long period of time. And then you have your lubricants. The lubricants, I put it in there as a category because it's very temporary and it's very specific. It's really for intimacy to help you during intercourse so you don't feel dry, all right? And then you have your hormonal or your medicated moisturizers. These are the ones that you need from a physician like myself or a prescribing health provider that can guide you. So you cannot get this over the counter. You need some sort of prescription from a physician like myself, okay? So the entire talk is going to focus on those three categories, and I'm going to dive into each one a little deeper to give you the ingredients, the benefits, the risks, and just basically everything you need to know. Take note, guys, because when you go to Target, Walmart, any chain store, CVS, Walgreens, you're going to see when you go there, I want you to go to the intimate wellness section and just give yourself 10 minutes. Just go line by line and read every product that's there. It's not going to take you that long. This particular topic today is going to be helpful for you when you go and do that because that is an industry that's growing, and there are so many products out there, and sometimes it can be overwhelming. So I'm hoping that at the end of this podcast, when you go, this will help you to kind of navigate yourself easy. All right. Okay. Number one, non-hormonal vaginal moisturizers. I particularly love this because this is over-the-counter products. They're designed for your everyday use, for hydration, for the vaginal vulval tissue. The most common ingredient is hyaluronic acid. Hyaluronic acid is a humectant. And yes, this is the same hyaluronic acid that you use on your skincare on your face. So when you go to your Sephora, your Ulta, you buy all this skincare products on your face that's hyaluronic acid based. Yes, that's the same one I'm talking about. So there are products that include these ingredients for the feminine area. There's Bonafide. That's one common one. You probably have seen it on social media everywhere. It contains hyaluronic acid, and that's something that you can use. Another ingredient that's common in the non-hormonal vaginal moisturizer is your glycerin. So glycerin is something that's very popular, and it's also out there as an ingredient. And then you have your soothing botanicals. That's your aloe vera. So if you look like over the counter, your Vagisil, for example, you might see Vagisil aloe vera for vaginal itching. Yes, that's what I'm talking about. Those are your moisturizers. Again, the benefit is that it restores your natural moisture. It alleviates mild itching, irritation, and it really helps with the dryness that's due to all those causes, okay? And the good thing is it can be used long term. Oftentimes, I have patients that would ask me for something will help with vaginal dryness, and they'll say, Dr. Aim, I don't want any hormones. Of course, I give them an education of hormones, so we're going to talk about it later on. But I always tell them, okay, try over-the-counter Vagisil. It's a very simple thing. Use it externally. It's not meant to use it internal. So what that means is use it on the hairy part of your vulva. Do not insert it inside the vagina. And that can really help with itching and some simple discomfort. And I have a lot of patients, especially my elderly patients, that are happy with this product. Okay. And again, this is not an ad for Vagisil, but it just happened to be the one that I speak of at this moment. But there are so many other products that are over the counter, like I mentioned, that have hyaluronic acid, aloe vera, and also glycerin. That is very good. What are the risks? Well, fragrance. You may not be compatible with a particular product because it has fragrance. So I'm always cautioning my patients to look at the label and make sure that it's fragrance free so that you don't run the risk of having irritation. Okay. There are preservatives in this product as well that can cause irritation to sensitive skin. Obviously, doing a patch test is always a good thing to try, but definitely read the label. You want to read the label to make sure that the ingredients there are not anything that's allergic to you, or if you have any questions, you can ask, okay? In general, avoiding glycerin-based products if you're prone to yeast infection, because glycerin can promote fungal growth. So that's just something to FYI, all right? Now we have our second category, vaginal lubricants. So I just got through talking about non-hormonal vaginal moisturizers. Now I'm going to talk about vaginal lubricants. That's its own category. Vaginal lubricants, when you think of it, just immediately you're thinking temporary use, often during sexual intercourse, and it's basically to help reduce dryness and discomfort during the act, okay? And there are different types of vaginal lubricants in the market. There's water-based, very easy to clean, compatible with condoms and toys, and may dry quickly, but it's compatible. So that's a very popular one and common one to use. Then you also have your silicone-based lubricants. It's convenient, it's pretty compatible, but sometimes it's a little bit harder to wash off, and it may stain your fabrics, like, underwear or bed sheets. So, but it's an option if you want it. Okay? Yeah. Now, you have your oil base. So I love doing this podcast because, one of the things is that whenever I'm going into detail explaining different products or items, I do come with a note, guys. And I try to be very thorough in this conversation because I feel some of my audience are taking notes. So let's get back into it. Oil base. Oil base, these are your natural oils like coconut oil. It is a form of vaginal lubricant, but remember, it can break condoms, so it's probably not ideal for you. The benefit overall of vaginal lubricants, meaning water, oil, silicone, is that it's immediate relief for friction. So during sex, it's really good to relieve that. It's also helpful to just make, your love-making session easier. What are the risks? Well, oil-based lubricants can cause vaginal irritation for some. Silicone-based lubricants might not pair well with other silicone devices. So if you had to pick one, go with water-based. And when you get this over the counter, it's going to tell you. So just read the label and see what is oil-based, water-based, or silicone when you're choosing a vaginal lubricants. Now, we go to our third category, which is hormonal vaginal moisturizers. Overall, this is a prescription-only product, meaning that you have to see a physician like myself or another healthcare provider that's prescribing to get access to this. So it's not something you can get over the counter or Amazon. All right. So the ingredients is estrogen or DHEA. Let me sound that out. D as in dancing, H as in home, E as in elephant, A as in apple. Those two ingredients, those are your hormonal-based prescription for vaginal moisturizers. Let's get a little deeper into estrogen because you've heard me talk about it a lot, but let me just explain some things that I think will bring some clarity. First off, it addresses vaginal atrophy and severe dryness due to whatever the reason could be. It could be as you age, menopause, perimenopause. It could be due to certain drugs, post-cancer treatment. It could be actually after giving childbirth. That's a very common thing. I saw it a lot with my OB patients, especially these young moms in their 20s. They'll have their baby and they'll come in the postpartum visit and like, Dr. I am sex is horrible. It's painful. I don't want it. It's uncomfortable. Yeah, it can happen, ladies. So in that case, hormonal-based prescription is helpful because that's the estrogen, So I did prescribe it a lot to my patients and they found relief. While I'm on that topic, I also had patients that I would tell them, get it over the counter. If they didn't want hormones or prescription, just try something over the counter. And this is where I'm going to give you a personal story about myself. When I had my daughter, I was one of those patients, I had vaginal dryness and it was not fun. And one of the products I personally used was over the counter. It's called Replen, Replen. Now, this is back in 2005. And guess what? For this podcast, I went and got Replen. So obviously, if you're listening to this, you cannot see this box that I have here. But if you're watching this video, you're going to see that I brought the box and I just wanted to show you. This is not a sponsor or anything. I just happened to have used Replen and I loved it back when I had my daughter. And at that time, I just didn't want any hormones. So Replen was a good moisturizer. It does not have hyaluronic acid, okay? It has another product, ingredient that's helpful to draw moisture into the vagina. And so that's something you could use. I apologize for digressing, but I thought that was a very important moment to interject that. So let's go back into hormonal vaginal moisturizers. I was talking about estrogen, and in this category, another ingredient is DHEA. So what are the benefits of estrogen moisturizer? Well, it improves elasticity, okay? It helps with hydration. It addresses underlying hormonal deficiencies, okay? So we want to make sure that we understand the cause before prescribing, because otherwise, if you don't, then you may miss out on something. The risk of estrogen is really not much, you know? I know the general concept or the general fear I hear from my patient is, I don't want to get breast cancer or I don't want to get cancer taking estrogen. And the overwhelming truth is that you can use local estrogen. Local means just in the vulva vaginal area, even as a cancer survivor, a breast cancer survivor, even if you have breast cancer, you can. There are literature out there that show this. And because it's such a localized, focused ingredient and it doesn't have systemic interaction, you are clear to use it. But obviously, talk to your oncologist, talk to your GYN to get more clarity on this, okay? So, but you can use local estrogen if you're a post-breast cancer survivor. Now, there's another fun category that I included in this discussion, and I wanted to just talk about it. I call it your natural DIY option. Basically, this is like coconut oil, almond oil, aloe vera gel, and the good thing is these are all pure. There's no additive. And I add this there because I do have some patients that are like, Dr. M, I do my own stuff. You know, I have my own stuff that I do. And that's fine. You can do your own stuff. But remember, the benefits are simple. It's chemical free. It's easily accessible. It's affordable. The risk is that natural doesn't always mean hypoallergic. What does that mean? Well, it can disrupt your vaginal pH, especially all those oils, right? And it can increase your risk of infection. So keep that in mind when you're doing your DIY. And I have to mention that as a token because, again, I have a lot of patients that are like, Dr. M, I do my own stuff and it works. That's fine, but just keep this information in the back of your mind as you do that. So overall, let's talk about the benefits of feminine moisturizers. Why is it good for you? The benefits are endless. It maintains vaginal, vulvar tissue health, improves overall comfort and confidence. I mean, can you imagine you're having vaginal irritation and you don't have relief? You're going to be irritable. So when you get that treated, you're comfortable and you're confident. It helps with micro tears because when you are very dry, whether it's from hormonal changes or just whatever the reason, you get these micro tears in the vulvovaginal area. Patients will know this. And when you go to urinate, you make it some stinging feelings down there. That's because you have those micro tears. So if you use a vaginal moisturizer, that can take care of it. All right? And in some cases, it really just helps support a balanced, healthy pH. We need to have our pH balance, and vaginal moisturizers are a good source to get us in that space. So every small step counts towards a bigger difference in how you feel and your quality of life. All right. So overall, there are some potential risks in the feminine moisturizer space. There are. The main risks are allergic reactions. And again, you may not know until you actually use the product and then you find that you're more irritable. In that case, stop. Don't continue. Consult your physician. Consult the healthcare prescribing provider. Okay, your physician. You can start with that. All right. It can also disrupt your pH. So keep that in mind. Not all moisturizers are pH balancers. It may actually disrupt your pH. So that's a risk. And then overuse over time can cause, discomfort. So, or it may not. But if you find yourself heavily dependent on it, maybe we should look further and not make sure that there's some underlying cause that we're overlooking. So that's something to keep in mind, right? Just making sure that we're not masking a bigger problem. And infections. As I mentioned, if you're using some oil-based product or glycerin, you can prone yourself to infection. So that's something to keep in mind with these vaginal moisturizers for the most part. So as I conclude this particular topic on feminine moisturizers, How do you choose a feminine moisturizer? There are a couple of things. When choosing a feminine moisturizer, number one, look for labels that say gynecologist tested, fragrance free, paraben free. So remember in the beginning of this podcast, I told you, I want you to go to Target, Walmart, CVS, Walgreens, wherever you shop, and just spend 10 minutes of your time looking at the intimate wellness feminine section. Look for all those things, gynecologist tested, fragrance free, paraben free. That's a good start, all right? And then you're going to look at your own need. Why do I need a feminine moisturizer? What's causing it? Do I want hydration? So I'm looking at hyaluronic-based products more so. Is it for intimacy? I just need it during sex, for condoms. Or is it a medical issues where I might need a prescription, obviously, for hormone therapy? So consider consulting your doctor for severe chronic dryness. So if you find yourself self-treating over the counter and you're just not getting relief, please schedule an appointment. Sometimes the dryness is a bigger problem and we don't want to ignore it, okay? That is your feminine moisturizer topic, conversation 101. Just keep in mind, and one thing I always say is feminine health is self-care. And using moisturizer isn't a luxury. It's a necessity. So don't make it like, oh, this is a luxurious thing I'm doing for myself. No, this is self-care and it's very important. All right? And it's part of your maintaining your well-being, your wellness. So I want you to be informed, be intentional in choosing what works best for you. So what works for you may not work for your girlfriend, your sister, your mom, or any woman in your life. And remember, ladies, when you prioritize your health and comfort, you empower every other part of your life. Yes, I'm going to repeat that again. Or maybe not. I know you guys catch it the first time. The important thing is that you want to empower your health. You want your feminine area, your intimate area, you want to prioritize it in caring for it, just as you do your face. Oftentimes in my office, I say that, the vulva vaginal skin is your skin on your face. The same amount of love and TLC you give to this face, I want you to give it to your vulva vaginal area. And do me a favor, ladies, if you're listening to this podcast, you've never done this before, I want you to do this. Grab a mirror, take a look at your vagina, your vulva. I want you to look at it, familiarize yourself with it. In my office, when I'm treating my patients or doing something in that space, I often have a mirror and I allow them to look at it so that we can have a conversation. And it's always easy to personalize it when you can visualize your own anatomy. So that's your little assignment from this podcast. I want you to take a mirror and look at your vulvovaginal area. Again, ladies, if you're a guy listening, you can suggest that to the woman in your life, but she'll be the one to decide, okay? As always, thank you for joining me today on the Polished Beauty podcast. I hope you enjoyed this episode and thank you for listening. Video recording of this episode will be featured on our YouTube channel, Dr. Daisy Ayim. We are also found on Instagram at Polished Beauty Podcast or at Dr. Daisy Ayim. Remember, a new episode drop every Wednesday, so stay tuned. Please like, share, follow.